Team will be on the ground for the next 3 weeks to monitor cases of typhoid. 5 people in the province contracted the disease last week and a Malawian woman died at the Charlotte Maxeke Hospital. However, the department says there's no need to panic.
Meanwhile, Gauteng's Health Department spokesperson Steve Mabona has urged the public not to panic. The 27-year-old woman had just returned to South Africa from home via Mozambique. Meanwhile, an 11-year-old patient has since been discharged and the other 3 are recovering in hospital. Typhoid is spread through eating or drinking food or water infected with human waste from an infected person. The department says water samples are being taken from affected families and it's also conducting health checks at workplaces. Some of those affected recently travelled outside the country.
We have positive outcome now that have been reported that the 2 babies that are at the Edenvale District Hospital, they are doing very well compared to how they were yesterday when we visited them with the MEC. Fever is down and they are stable, they are improving very well. And there's what the 11-year-old has been discharged. He's now home and being treated. There's medication that one has been prescribed. And we are saying, yes, the 2 babies have a relation in a way, but then we are saying people need to be concerned, we not need to be too much alarmed, because yes, it's not an outbreak, but then we had to activate the outbreak response team so that we make sure that the cases are managed properly, because we had to release your environmental practitioners to go to the homes of the families and check on the water, because this emanates from the contaminated water, food. So they need to do all those tests and make sure that we know what might have been the cause.
Are these the only people that were affected by the typhoid?
Look, it's 5 cases, because we learned yesterday at the hospital that there was 1 patient again. So the 27-year-old Malawian passed away on the 17th of January, that was Sunday. And there's 1 16-year-old at Charlotte Maxeke. She also been improving very well. So we can safely say that the situation is under control. What we need to put an emphasis on is that people need to be cautious. We need to wash our hands when we go or when we come out of the bathroom, and make sure that we wash, any vegetable or any food that we're cooking that needs to be washed. And, your fruit, make sure that you wash, and then wash hands and make sure that you don't contaminate anything.
Now, for those who don't know, what is typhoid and how do you contract it?
Look, we were informed that it's quite an infectious disease, emanates from contaminated water, food. So the symptoms, you have high fever, others will be suffering from a severe headache, and you have constipation, or you have abdominal challenges, some are nauseous, and there's an element of a diarrhea we were informed yesterday. So it's quite a challenge, but it's not a common disease in the country. Hence, the initial patient was then, the focus was more on malaria. Do all those tests, only to find that when they continued with the test and realized that it was actually typhoid, but it was very late. Unfortunately, she had passed on.
Is it contagious and can it be spread?
No, look, we were informed that you need to be, have a very close contact to can, contaminate or can have contact it, and so. As long as we are very far from the person who has that fever, it should not be a problem. But we are saying all our health professionals, our facilities, they are on the alert. They know the symptoms, and we've encouraged those that they will not be in a position to can treat at that lower level to escalate and transfer the patients to the higher level. That's where they will take necessary tests and make sure that if one is diagnosed with typhoid, they will be in a position to can be treated. And up to so far, the situation is under control. We are on top of things. We are on the ground, and the MEC has assured the Gauteng public that the outbreak response team will be on the ground for the coming 21 days.